Here's a hypothetical situation for you. Say you were suffering from episodes of excruciating pain that were crushing your dreams, and you've been in and out of hospital for years. Then one day, an opportunity, in the form of a new treatment, presents itself that could remove these symptoms, potentially forever. But the thing is, you'd be the first person ever to receive this treatment. Would you take it? For Victoria Gray, this wasn't a hypothetical situation, but her reality. Victoria had been diagnosed with sickle cell disease at the age of 3. It seemed like every dream she wanted to pursue, from cheerleading to nursing, ended in a no from either her doctor or her condition. Victoria was approached and ultimately volunteered to be patient 1 for a CRISPR gene therapy to treat her sickle cell disease. Victoria has been living free from constant pain since, and has been able to fulfill some of her dreams. To hear more about Victoria's incredible story and the gene therapy landscape, have a read of the latest issue of the Scientific Observer. You can click the link to get your free copy.